Hello and welcome. You're watching NDTV 24/7. I'm Vedant Agarwal. Our big focus on this show is that a recent study says that cancer patients spend almost 3.3 lakhs a year when it comes to their out-of-pocket money on treatment. This is what a study published in the Frontiers in Public Health says. Now, tests very significantly account for 36% of the entire out-of-pocket expenditure for outpatient treatment. Now, medicines constitute 45% of the out-of-pocket expenses during hospitalization. Patients spend 3.3 lakhs a year of their own money, regardless of which medical insurance you actually subscribe to. Now, this study was conducted with over 12,000 cancer patients in India's top hospitals, and average patients spend over 8,000 rupees of their own money per outpatient consultation. Now, average patient spends over 39,000 of own money each time the patient is hospitalized. Very significantly, 60% patients seeking outpatient treatment, 62.8% of hospitalized patients have some form of insurance. Most health insurance schemes only cover inpatient care, and even for inpatient care, initial diagnostics are not covered. Now, the government's Ayushman Bharat scheme that has cancer packages, but they should also include outpatient care, is what this study is in a sense advocating. I'm being joined by very special guests on the broadcast to talk about this issue and whether insurance should also cover diagnostics and tests. Dr. Anita Ramesh Chandra, Senior Medical Oncologist from the Apollo Speciality Hospitals, Chennai, is joining us on the broadcast. Also with us, Venkatesh Naidu, CEO and Principal Officer of Bajaj Capital Insurance. Thanks very much for joining us on the broadcast. Going across to you first, Mr. Venkatesh, this idea that medical insurance should also cover outpatient care, including diagnostics, also the various tests that have to be conducted, particularly when it comes to cancer, where diagnosis is really key to determine what stage you're at and how the cancer is in a sense progressing. What do you have to say about this idea of medical insurance actually including diagnostics and inpatient care, outpatient care, I beg your pardon, because that's something that costs a lot to cancer patients?
Absolutely, I completely agree with you. In fact, the biggest drainer for most people who, encounter cancer is diagnostics and care. Right? I must tell you that now there are several plans, excellent plans that have been launched by health insurance companies to go and cover diagnostics. However, customers need to take extreme care while choosing the plans. Okay, today the plans cover diagnostics. Most plans only cover diagnostics 30 days prior and 60 days post the treatment. Okay. Today there are some attractive plans which also allow you to choose plans where 60 days pre-diagnostic as well as post-diagnostic, almost 180 days is covered. So if people are smart about choosing the right insurance plan, this is something that is certainly covered. Okay. While there more can be done by the government and the PMJAY plan, but there are several private insurance companies today who are offering excellent plans that cover 60 and 180 days.
Right, significant points there. But going across to you, Dr. Anita Ramesh, you are a senior medical oncologist in Apollo Speciality Hospitals. You see, cancer patients from all, strata of society, from all classes really coming in. What is the kind of burden that they have because of medical insurance not covering outpatient care? And from a doctor's perspective, really, how important do you think is the diagnosis aspect when it comes to cancer care? And do you think that, should be a part of medical insurances?
Yes, a very important question for discussion. I'm a medical oncologist last 23 years, and in active practice, average I see 50 to 60 cases per day. Yes, let's divide the patients up into three groups. One is in the medical colleges where they are below the particular definite line. Yes, that's a different thing. But when you talk about patients who are having private insurance, first point to say, we do not know when we are going to get cancer. So even the screening master health checkup is not covered by any of the private insurance company. Yes, sometimes these patients get done a CT scan outside for some pain abdomen. But yes, then you do a biopsy. The biopsy is not covered. The scans are not covered. The blood test is not covered. And all patients are not intelligent enough to think that I might get cancer and I can have the diagnostic and take a package at that point of time, or thought earlier to take the package. So most of the diagnosis initial part, which is very, very crucial. See, in a diagnosis of cancer, we do need a minimum PET, MRI, CT scan, whatever is available. You need a tissue histopathology to diagnose the case. And now is the era of precision oncology, where you also need the tissue to do molecular testing to give what drug is appropriate. So all this minimum cost will be 75,000 to 1 lakh. And the patient, when we tell them to do, we also don't know as a doctor. We say we are suspected at cancer, but we do not know whether it is cancer or not. Some of them wants admission to get it done with the insurance, but it comes back not covered. Some says,
let me get Mr. Venkatesh Naidu on this point. You're making a very important point. Let me get Mr. Venkatesh Naidu on this point as well. Do you think, Mr. Naidu, that, cancer has to also be seen as a separate category in itself when it comes to medical insurance, because you can't, in a sense, combine it or, see it in the same category as other, perhaps, other diseases. Cancer, in a sense, does require a specialized approach when it comes to medical insurances as well.
Absolutely. In fact, cancer like diabetes is now being seen as a very separate category. And if you look at it, now insurance companies are coming up with cancer-specific plans. And it is getting covered as a very separate disease. And in fact, it's coming as a very important critical illness rider. Even the critical illnesses on diagnosis, they're going ahead and paying a block money to cover all such expenses. Dr. Anita, like she said, very, very important. There is significant expense pre-diagnosis, at the stage of diagnosis. And that is something that now some very, very good insurance plans are covering.
All right, Dr. Anita Ramesh, if you could quickly respond to that as well and talk about, some of these patients who come to you who really desperately need this kind of support from medical insurances and who find it hard to actually finance their diagnostics and finance, these tests that are a very essential part of cancer care.
Yeah, quickly to tell one more thing I want to add. It is not the initial diagnosis. There is, after giving 3 cycles of chemo, or we do a surgery, we change to radiation. Every step we need to see the response. We cannot close our eyes and treat. So there is subsequent assessment of response, which will need an equally amount of money at 3 to 4 months. Right. Again, 3 to 4 months at the end of 1 year. At the end of 2 years, we may say your cancer is decreased. But then if you relapse, the scan and the cost keeps on increasing. We do sometimes do a repeat biopsy at the end of 2 years. Yes. So this is one part of it. Now, if you have Absolutely. A private insurance, may not be your initial, may not be covered. But then what we do for our patients is that for the subsequent treatment, we admit, medical oncologist, I do admit for chemotherapy, and I say this is your last cycle, finish off the PET CT and whatever test we want in this admission to get it covered by insurance.
Absolutely,
but then
Doctor. And the crucial point you were also making, that it's not just initial diagnostics, but through cancer care and through the treatment, one does require to assess how the patient is, in a sense, responding to treatment as well. Thanks so much to both of you for joining us.
I want to tell you one important point for the Ayushman Bharat. See, I'm also in the medical college. Now, the government scheme has done extremely well. I'm doing this Tamil Nadu Chief Minister scheme over the past 10 to 15 years. Initially, diagnosis was not covered, but the last 3 years, CT scan, biopsy is covered by the Tamil Nadu Chief Minister scheme. And there are designated centers. You send the patient there. Scans are all covered. It is free of cost. And yes, Ayushman Bharat incorporated. Already the package has started, but we need to popularize it more.
Absolutely. Thanks so much, Doctor, for joining us with that important perspective. Thanks to Mr. Naidu as well.